Thank you for being here this evening. I'm going to ask Mr. Ross to come up, and he is going to welcome us for the evening.
Good evening, ladies and gentlemen. I'm Dave Ross. I'm on the Spotsylvania County Board of Supervisors. I represent the Cortland District, and I want to thank everybody for coming out tonight. I especially want to thank the Community Collaborative for Youth and Families for sponsoring this series of town hall events. The Community Collaborative is our region's preventive coalition working in partnership to support the citizens of our community. So I'd like to start really quick by just recognizing a few elected representatives, because this is a key issue. It's important to everybody, or those that might be running for office. So with that, Greg Benton is a fellow supervisor on the Board of Supervisors of Spotsylvania County. Thanks, Greg, and his wife, Susie, for coming out. I have Debbie Kersey, who's a candidate for the Berkeley District. Debbie, if you could raise your hand. She's out here. She's very interested in this. And Mike Berry is a candidate for Lee Hill District. Mike, thanks for coming out with your wife, Vivica. So, unfortunately, last year, there were 24 overdoses related to opioids right here in Spotsylvania County, right here in our home. Our community, like many across the Commonwealth, has come together to bring hope to those affected by this harmful drug. Another bad statistic, the Virginia Department of Health reports that on the average, 2 Virginians die every day from prescription opioid or heroin overdose. In fact, for those under 50, overdoses is the leading causes of death for our citizens. Unfortunately, this epidemic is worsening. Early data from the Centers of Disease Control suggests that the drug overdose deaths will continue to rise this year, and it's estimated that over 2 million Americans are dependent on opioids, and 4 out of 5 new heroin users use opioids before heroin. Now, most of us know someone impacted by substance abuse. I know when I was told that I would be introducing this, I thought of at least 5 instances in my own family or relatives or friends or neighbors that I could think of, and I'm sure everybody here can think of a friend or family member where it's taken its toll. And this opioid addiction does take its toll. Families are torn apart. Children are growing up without parents because they've lost their lives, their mothers or fathers. Opioid use disorder is a complex issue, and there's no single approach to solving it. It will take a collaborative effort among medical professionals, insurance companies, employers, communities at all levels of government, including the church, to come up with effective solutions. More must be done if we're going to make progress in helping to solve this crisis. So I want to thank you again for being here this evening. Thanks again to the Community Collaborative for hosting this event, and also for the panelists that are going to be introduced shortly. Thank you.
I also wanted to thank Spotsylvania County and Salem Fields Community Church for the possibility to be able to live stream this event tonight. So we're welcoming those that are out in their homes. Being able to reach additional people in our community is really vital, so we're really appreciative that we were able to do that. We're going to go through a very brief presentation with some statistics and some information, and followed by the viewing of the movie. And then we're going to go into our panelists' discussion. There's some information in the back, and there's some refreshments if you want, so help yourselves. So Mr. Ross told you a little bit about the Community Collaborative, and I'm just going to share a little bit more. The Community Collaborative is our region's prevention coalition. I am the current chairman of the Community Collaborative, and Michelle Wagaman, who's here this evening, is our vice chairman, and we have several leadership team members and members here tonight. We have about 35 to 40 member agencies representing many different facets of our community that come together once a month to discuss important topics that are happening in our region and coming up with some solutions as a group. It's a very invested group of people, and if you're interested in joining us and being a part of what's happening, we have a website. You can sign up, or you can talk to any number of us this evening, and we'll give you some information. So I'll go through just a few statistics. In 2016, the Commonwealth of Virginia experienced quite a few fatalities and overdoses and deaths due to opioids. So 8,686 ER visits due to the overdose. 75% of all fatal drug overdoses involved opioids. 1,133 opioids overdosed to death, and then 4,076 Narcan administrations. So this is across the state. We're going to give you a few more statistics for your county as well. So here you can see we've listed all the localities in the planning district. The one that's circled in red is Spotsylvania County. And as Mr. Ross mentioned, last year there were 24 overdoses related to opioids, and you can see that the numbers are climbing. This is some additional information. Here we go. So in 2017, you can see that there were 117, and that's to date. It's January through October. There were 117 heroin overdoses, and 11 of those were fatalities. So even though the number of overdoses is increasing, the fatalities is decreasing due to the availability of Narcan. So there have been 20 prescription drug overdoses with 1 fatality in 2017. And in Spotsylvania County, all fire engines, ambulances, and deputies are equipped with Narcan, and that's including school resource officers, which is a huge thing. In fiscal year 2017, EMS responded to 219 narcotic overdoses that were treated with Narcan. And when we get to our panelists, we have representatives here tonight from both the sheriff and fire and rescue, and they're going to be able to give you a little bit more details about these numbers. So some fast facts about addiction. So the face of addiction is it can happen to anyone. It's across all kinds of different socioeconomic, race. It doesn't really matter. You see it everywhere. They don't discriminate. Each day, 1,756 teenagers abuse a prescription drug for the first time. That's huge. That's a huge number. Each day, 78 people die from opioid overdose. This one always gets me. I've read this a lot, but every time I read it, 1 in 5 high school seniors report misusing prescription drugs at least once, yet only 12% of parents think alcohol or drugs is a problem in their home. So part of why we're here and part of why we're trying to share as much information is so that parents, family members can start having conversations about opioids and what it can do. 9 in 10 addicts started experimenting before they turned 18 years old. And most first-time users obtain the drug from a family member or friend. We're going to talk a little bit about what you can do with the drugs that you might have within your home. And we have some lock boxes here tonight that you can take with you as well. So what can we do? So we can talk. We can talk with our children, with our neighbors. We can talk with our friends' children, having those conversations and explaining what addiction can do, how quickly it can happen, explaining how to properly take a prescribed medicine. There are a lot of young people who play a lot of sports. That happens. It starts there a lot of the time. Get an injury and they're prescribed an opioid. So teaching them what that means and how quickly it can change if they don't follow how it's prescribed. Be aware of what's in your home. Check your medicine cabinets. I did this recently, and I found some prescriptions from 5 years ago. I forgot I had them in my medicine cabinet. It's really important to document, to keep that, a log of it somewhere, or just really be aware, keep it locked. And then if you don't need it anymore, get rid of it. And there are a lot of places you can do that now. There's a drug take-back day coming up that Mr. Barbuti will talk about. There is going to be a drop box. I heard that this in Spotsylvania County that they're going to announce later. There's a drop box in Stafford County now where you can just anytime can go and drop off your medication. And I believe there's one in Caroline County or King George, one of those. So we're really trying to make it more available and accessible for people to get rid of the medicine. And that includes, this came up at one of our other town halls, pet medication. You wouldn't think about it, but pets get prescribed opioids too, and those are medicines that you have to track as well. So what are we doing as a community? One thing that we're doing is these town halls. This is our 5th town hall. We've had one in every locality. Very well attended, a lot of great conversations, a lot of good questions, and a lot of awareness has transpired because of this. The other thing that has happened and that kind of fueled this whole thing was on May 10th, a collaboration between Mary Washington Healthcare and the Community Services Board sponsored an all-day workshop followed by a town hall event similar to what we're doing here. During that strategic time in the morning, there were more than 50 different representatives of our community that got together and started having a conversation. We had a lot of statistics provided to us. We had someone that kind of guided our conversation so we could talk about strategies. What is it we can do as a community? How can we get together and start talking about this and working together to face what we're facing? As a result of that day, we had 3 work groups that were formed, one on prevention, one on treatment and recovery, and reduction of harm. Those 3 work groups have been working and meeting since May 10th and strategizing on different things. A lot of things have already happened. They're working on different types of strategies, and they're working on grant opportunities, looking to see what we're able to do here in our community. If you're interested in being a part of one of those work groups, there is an opportunity. Community members are really important. This is an effort that takes not just professionals, but community members as well. So if you're interested in becoming a part of that, let us know, and we'll get you to the person that can get you linked up. The other thing that has happened is we have formed a Healthy Community Advisory Council. This is a group of 17 leaders in the region representing all planning districts that are going to oversee the work of the work groups and kind of keep this train going. This is not something that can be fixed quickly. This is a long-term This will take very much time. So we're going to be working as an advisory council to kind of maintain what's happening. I just read in the news today that the president is talking about declaring a public health emergency for the nation due to opioids. So this is something that there will end up being some federal dollars, some state dollars that hopefully will come down to localities so that we can have the resources we need to make an impact. Now I'm going to invite Mr. Barbuti, where is he? Oh, here he is. He's going to come up and introduce the movie and share a little bit about how the movie was made and how it has been disseminated.
Thank you. Hi, good evening, everybody, and thanks for coming out tonight. It's really great to see so many people here tonight to take such an interest in this important topic. As you said, my name is Mike Barbuti. I'm the Assistant Special Agent in charge for the DEA office in Richmond, Virginia. I've been with the DEA for over 25 years, and I have to tell you that I've never seen a drug epidemic like we're facing here today with the opioid crisis. And I know we have medical professionals here tonight that we'll hear from and are in the crowd, and so I don't use a word like epidemic lightly. But I really don't know what else to describe it as when you talk about 64,000 people last year, approximately, dead from drug overdoses in this country. Over 160 a day, more than the victims from car accidents and gunshots combined. So I don't know what other word to use, and it's worse than I've ever seen it, like I said. And when you talk about the 64,000 victims, I mean, that's a horrible number, but what we often neglect and we don't talk about are the people left behind. Each of those 64,000 people were a father, a mother, a son, or a daughter, a sibling, a spouse, a coworker, a teacher, and they leave behind the people that, their family members to pick up the pieces, and they'll never be the same for the rest of their lives. So, we talk about the victims and how horrible it is, but we really need to take into account everybody it affects. And I'm not even considering the costs in terms of the medical cost, the number of children going to foster care, the babies born addicted to opioids. It's just a problem of epic proportions, like I said, a true epidemic. And how did we get here? How did we get to this point? Like I said, I've been with DEA for 25 years. There's always been heroin in this country. There's always been heroin investigations. I was doing them 25 years ago. What's different now? Well, traditionally, heroin users have been people who kind of sought out the drug to get high and sought out drugs, for that purpose. Why is it now that we're seeing it in people that have never had that issue, in places and towns and cities that have never experienced that? Why are we seeing it in rural areas and suburban areas, rich, poor, every socioeconomic background? And the answer really is prescription opioids, prescription pills. 4 out of 5 new heroin users get addicted to prescription opioids and prescription medications. And like was said earlier, it could happen any number of ways. It could be kids experimenting in their parents' and grandparents' medicine cabinet. They see pills, they say, hey, this can't be that bad for me, it came from a doctor, and they don't realize what they're getting themselves into. Or it could be, a construction worker hurts his back, someone gets their wisdom teeth out, and they get prescribed opioids, and they're not aware how easy it is to get addicted to them. And there's not that education out there. For many years, there hasn't been that education to let people and let parents know what to look out for and what to be aware of. And that is caught up to us, unfortunately. And first people will start out, you'll see in the movie that I'm going to introduce, Chasing the Dragon, people start out taking the pills for legitimate medical purposes. They had an injury or they got it from a friend, just to help with a problem. And then they're taking 2, and then they're taking 3, and then they're taking 4 because they're building up their tolerance. And when they can't get that same high, or when the prescription runs out, they turn to heroin because it's cheap and it has the same effect and it's readily available. And so they get hooked on heroin. And everyone starts out saying, well, I'm just going to snort it. I'll never use a needle. That's not me. And everybody always ends up there, and it takes over your brain, and I know we'll have addiction specialists here and people who can speak about that part of it better than I can, but a switch gets flipped, and you'll see in the movie, that's where everybody ends up. And then what happens? The drug cartels and the drug dealers, to make more money, start substituting the heroin with a substance like fentanyl, which, if you're not aware of, is 40 to 50 times more potent than heroin. It's a synthetic opioid made in a lab overseas, sent to the United States or sent to Mexico to be smuggled up by the cartels and mixed in with the heroin or just sold separately. And this is so powerful, as little as 2 to 3 milligrams, equal to 5 or 6 grains of salt, can be deadly if inhaled or absorbed through the skin or ingested. So, a heroin user thinks they're getting their regular dose of heroin, but you don't know what's in there. And now they get fentanyl mixed in. And next thing you know, you have an overdose or a fatal overdose because they're getting a much higher dose than they're used to. And why do the cartels do this? Because it's cheaper, it's more potent, it's a way to make more money. They don't care how many people are dying from this. They care about their bottom line, which is money and greed. And that's why they're in this in the first place. So I can go on and on for this. I'll hopefully have some questions, and I know we'll have some other panelists up here that'll have a lot of things to say. But I just wanted to, again, just give my perspective of how we got where we are today. And what's going to solve this problem? I mean, this is a cliche. I've read it so many times. I've heard it for years now that we're not going to arrest our way out of this problem. I mean, my field is law enforcement. My job is to try and arrest those people who are dealing the drugs, try to prevent them from getting into your communities and our communities in the first place. So that's my job. But what do I think will solve the problem? Everybody here tonight. Look to your left and your right. It's people like you that are here tonight that are going to take what you hear tonight, go home, talk to your kids, talk to your parents, talk to your classmates, talk to your coworkers, learn about this, pass on what you learn here tonight. Take this movie that you're going to see tonight and show it at home, show it in your workplace. It's available for free online at DEA.gov, FBI.gov, or YouTube. So go home and watch it. Everything you learn here tonight, you need to help spread the word throughout the community. And it's, like I said, it's great to have a turnout like this, but the way it's going to get solved is to get people to stop from starting in the first place, because it's so very difficult, once you get started, to get off of this, even with the treatment available. And I know we'll have treatment specialists here. It's just so difficult, and the easiest way to deal with this is to make everybody aware and educate everyone and stop in the first place. So again, I want to introduce this movie. This movie, Chasing the Dragon, was made by the FBI a couple years ago. They were kind enough to invite us to participate and help promote the movie, and you'll see our now ex-administrator along with ex-FBI Director Comey in the beginning of the film introducing it. And what I'd like to point out about this movie is first of all, to thank the people that are in it, because it's very difficult, for these people who lost family members or are recovering addicts themselves to tell their story and share with everyone what they went through in the hopes of preventing other people from starting. But the one thing I want to say is, this wasn't made in New York or Hollywood or Los Angeles. This was made right here in Virginia. You know, you'll see scenes from the Rappahannock County Jail, you know, in this film. Everyone in this film, you know, is from a 100-mile radius of where you're sitting here tonight. So this should hit close to home for everybody here. These are fellow Virginians who have struggled with this and who are, you know, trying to, again, put the word out to make this better for everyone. So, again, I hope to answer any questions you have. Hopefully we can talk about, like was mentioned, our Drug Take Back Day coming up on October 28th and some other things we're trying to do in the schools. But we'll get to the movie and hopefully continue the conversation afterwards. Thank you.
Hi, I'm Jim Comey. I'm the director of the FBI.
I'm Chuck Rosenberg. I run the Drug Enforcement Administration.
We're talking to you today because we are facing a crisis that is killing far too many people: prescription drug and heroin abuse.
Each year, more than 46,000 people die from a drug overdose. That's more people than die from car accidents or from gun violence. And half of those 46,000 deaths are related to opioid abuse.
We thought the best approach would be to let you hear the truth. No filter, no censors, just the straight facts from people who have lived with the hard consequences of opioid abuse. You're going to watch unscripted interviews that include some raw emotion and some profanity. You're going to witness real tragedy and learn what happens when drugs take hold of real people and don't let go. You will see that those whose lives are taken over by drug addiction are often kids from stable homes with strong families. Good people who had great childhoods, were given everything they wanted, and had everything going for them. But they took one wrong turn and they were hooked. And once you're hooked, it is so very hard to get off these drugs, and the spiral down is so quick.
After you watch this film, we want you to talk about it. We want you to talk to your parents, to your relatives, to your friends, to your brothers and sisters. If you know somebody who's using drugs or even thinking about using drugs, say something.
You're going to see that once the addiction starts, it is often too late. By telling somebody, you could be saving a life.
I didn't care. I didn't think about it. I just did it. Once we started getting high, it was done.
She was 17 years old, and the only way I knew about it is because she was arrested.
Started smoking pot around 18, and I was always offered prescription drugs, and I never would take them. Then I was in a car accident.
I was running down in the middle of the night to get some water, fell down the stairs, landed on my back on the wooden floor.
It started for me with pot and just progressed into hell, basically.
Weed didn't do it for me, but definitely weed started it all for me.
It was definitely something I didn't see until it was too late. I had no clue what I was getting myself into, so.
Started taking 3 at a time, and then I was taking 4 at a time, and then I started taking
I became
6
addicted
at a
that day.
time. When you're getting high, it's not just a drug.
You're hooked. $500 going to
And she was a convicted felon at the age of 18.
I had maggots in my leg.
Turned to prostitution.
Stealing from my family.
Married, mother of 3, and I'm
They're gonna
stripping.
take you to hell and back.
It's not just a little pill.
Takes control of you.
I started using heroin.
The same heroin that just killed me.
You can't go back and say I'm
And
sorry.
it will win.
It will get you.
Her sister found her.
Died in her sleep.
My daughter.
She was dead.
Being addicted to opiates is like chasing a dragon. You're constantly seeking that first high. But what's gonna happen if you actually catch it? great family, you know, always had what I wanted. Never had a curfew. I could sleep over at my friend's house whenever. I could have done anything. They would have paid for me to go to any kind of school, stuff like that, and they paid for guitar lessons.
I grew up with my dad. My mom wasn't in my life, though. He pretty much was mom and dad throughout the whole life. He would tutor me for at least an hour. On the weekends, we'd go out, we'd go camping, we'd go out on the boats. We always had something planned.
She started in gymnastics when she was like a toddler, and she was a cheerleader through middle schools, high schools, and she was also a competitive cheerleader. She started competing probably in 7th grade. She was a very good student. She was in AP classes, AP honor roll.
Worked myself up through the years with minimal college to a position. I worked as a corporate account executive. I was making about an average of $122,000 a year. Things were pretty good financially. We were secure. Kids were happy. We had no real issues.
Dad was military, mom was Korean. Everyone I grew up with was the same way. Everyone's parents was military and Korean parents, Korean mom. No, I did martial arts, ballet, gymnastics, did all kinds of stuff. I did piano lessons. I was an honor roll student, always went to school. I was like 3.43, grade point average.
I had a great childhood, great family. We did a lot of camping, a lot of fun stuff, going to the beach, camping at the beach. Very active in scouting, Boy Scouts, and something my father, me and him did together. You know, a couple days before my 18th birthday, I actually got my Eagle Scout, which was a big accomplishment for me.
I met my first husband when I was very young. I was 13, and then we got married at 17, so I got to grow up pretty quick. I was 22 years old, and that's when everything started. I got pregnant with my youngest daughter. Once I had her, they gave me Oxycontins. That was the pain medicine. And from then on, that's where my addiction started.
A friend offers you something at a party or at home, or you're having a bad day and you need something to pick you up, so somebody hands you a pill and says, here, this'll help you feel better. That's how this problem always starts.
I was at a concert, and I was 15 at the time, and I was drinking a beer, so I got a possession alcohol charge. I got put on probation, so then I couldn't smoke pot anymore. So I started to panic, and then somebody approached me and said, well, here, try this, and it was Oxycontin 80.
So I was hobbling into work, and a young lady that worked there used to be a pharmaceutical sales rep, and she had some samples of things. And she said, Katrina, have you gone to the doctor for this yet? And I said, no. So she said, well, I have these things. Take one, not more than that. Go home, take one, you know. And I had a habit every night where I'd go home and have a glass of wine. So I went home that night, and I took what she gave me, but instead of taking one, I took two, because I didn't even know what they were. And took the two, had my glass of wine, and all of a sudden, it just triggered something in my brain, and I would say I became addicted that day.
I think the new friends had a really, really big impact on, you know, when she got to that fork in the road, you go left or you go right, and I think at that point, the friends helped pick the road that she chose. This sounds really appealing. I'm gonna try that. But I guess what most people and most kids don't understand is, you know, when you try something, you're not trying it. It's your new path.
I just like the feeling of certain things being high. It wasn't like I'm depressed, so I'm gonna take this to make me feel better. It was kind of like I'm feeling good. I'm gonna try this to see if I can feel even more better.
Started taking 3 at a time, and then I was taking 4 at a time, and then I started taking like 6 at a time. And then I went from taking them orally to shooting them. And that was the end.
I went back to the doctor a couple times and got him to refill the medicine to the amount that he couldn't refill it anymore. So then I started buying Oxycontin off the street. From there, Oxycontin started to be more expensive and harder to find. A girlfriend of mine introduced me to heroin. I could get a whole lot more for a whole lot less. And then once I shot up the heroin, that was it from there. My addiction took off, and my daughter was 7 months old when I became physically addicted to heroin intravenously.
I never hesitate to ask them all which drugs they've tried. And they'll typically say, I've started off with marijuana, tried cocaine, I've tried oxycodone, and I ask them of all the drugs they've ever tried, what's the most addictive drug? And without a doubt, 100% of the time, they'll say the most addictive drug is oxycodone.
You know, the drugs, feel like it took my mind over and made me do things that I, normally brought up not to do, and it just turned me into a monster.
I just went in my medicine cabinet. My buddy's like, oh, hey, these will get you high. Let's do some. So I was like, okay, you talked me into it right here. I don't have to pay anything, sure. It doesn't even have to be a drug dealer. It could be right in your house. And next thing you know, you're hooked.
My friends in the beginning were the friends that didn't do anything, and then I met the crowd that did do stuff. You are who you hang out with. That is for sure.
These kids go into it as, I'm just going to go to a party, and hey, they're doing this over here. Let me, I want to fit in. Let me do it a little bit, and it's the devil. It gets you. It's, it's that temptation. Hey, this is a fun party over here. It'll suck the life out of you.
All I wanted to do, if it had been in front of my face, is do it. It's not just a little pill, Respect the power of that, of that pill. It's just because it's a prescription, it is every bit as deadly and every bit as addictive.
I worked at a daycare, taking care of other people's kids. I drove the daycare bus. I had to take their children to school. But before I could drive their kids to school, I was in the bathroom of the daycare crushing up pills, snorting them, so I could go about my day.
The whole time you're sitting there saying you're not a fucking addict, you're not addicted, guess what? You fucking are. Because why are you taking that hit saying, nah, dude, I can quit when I want? You're addicted. People are like, oh, I only smoke weed. I'm not addicted. It's natural. Whatever. Tell yourself whatever. Oh, it's legal now. Oh, fuck off. Whatever.
The first time somebody uses an opiate drug, the euphoria that they get is something that they continue to search for and seek for. So while you could do that in the beginning by just chewing on the drug, over time you can't get that high anymore. And so now you have to take it up to the next level. And nobody sets out thinking that they're going to end up being a needle user. But every one of those needle users will tell you that they couldn't get the high anymore doing it the way they were doing.
Heroin became my best friend. Heroin became the love of my life. I put heroin before my family. I put heroin before my children. And I thought that I couldn't do nothing in life anymore without heroin.
There's absolutely no difference between, in my mind, a heroin addict and a pill addict. We both will do anything to get it, break the law, do whatever. You're both addicted. You both go through the withdrawals. You both go, it's the exact same thing.
It's everywhere. It's in your cabinet somewhere. It could be in your grandparents' cabinet. It could be your friend's mom's cabinet. It could be anywhere. That's pills. But, well, heroin could be in a drawer somewhere. Who knows? It's all the same. One's just prescribed to you, and one you go cop on the street.
There's no way to say no with the opiates. It's hard. Real hard. I can tell myself no, 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 but my body, as soon as you think about it, you get anxiety, your palms start to sweat. You know, your mental ignores your physical part of it.
I am very angry. And one of the things I'm most angry about, and I tell her all the time, is that that drug was so much more important to you than me. And I'm the one that can help you. I'm the one that helps you. I'm the one that supports you. I'm the one that'll always be there for you. You need something, I'm going to be the one to take care of it for you. But something that literally destroyed everything good within you was so much more appealing. Wanted that so much more than anything I could offer her. And I'm angry. I am angry about that.
The progression of addiction and the behavior that comes with it is pretty standard, regardless of where you're born, how much money you have, how old you are, what your race is, what your nationality is. You can be the smartest person in the world. The minute that chemical hits your bloodstream, you lose control of what it does in your body. You can't control it. Nobody can control it. I don't care who you are. It's not controllable.
I lived in crack houses. And it's almost like something you see on TV, an abandoned building with drug paraphernalia everywhere. It might be a piss-stained mattress, and God knows what else is on it. There was actually a place in the city that we were at, and a lady had overdosed in the bathtub. She had died. She was still in the bathtub. We'll just find another room in the house. And that's what my day consisted of. It became my full-time job. The needle was my boss, a very demanding boss.
Your whole day revolves around it. You go to sleep doing it, you wake up doing it. You know what I mean? It's like some people smoke after every meal they have. No, you're doing a fucking shot.
It's a never-ending vicious cycle. It's the same thing over and over and over. You wake up, all you want to do is find out how you're going to get something, how you're going to get it.
You know, it's kind of stupid if you think about it, because I'm wasting all this money stealing from my family and my friends just to do a drug and fall asleep, you know? And then I wake up sick, so I'm like, crap, now I gotta do it all over again, you know? You're still chasing that first high. So, you know, in order to be high, you gotta at least be normal. And to get there, you gotta at least do enough to where you're not sick anymore, so.
Well, usually, like, if I had stuff the day before, I'd always save a bag for the morning time, so when I wake up, I could get well. And I call it that because in the end, I wasn't using to get high anymore. I was using to stay well, so I wasn't sick. You know, I'm not even getting high. I'm just trying to, you know, be able to get up out of bed. You know, my head was always in my lap, you know. I feel like I missed a couple years of my life because there's a lot that, I mean, it's just a fog, black fog, because, you know, I really wasn't there, you know.
My addiction level was so bad that I couldn't even function without 40 pills a day. I was ill. Like, literally every 4 hours, the chills started setting in. And I would wake up and I woke up sick. And that's the way it went all day long.
How do you know you're an addict? It's when you're doing something that you know is not good for you, that's harming you, but you can't help yourself. When your relationships are starting to fall apart around you, and you don't care, and the only thing that's on your mind is about how to get the substance and how to get to the next high, you're an addict. You can't maintain an opiate addiction and a normal life for very long.
I felt like after my first year of using it, I actually got physically addicted to where I actually needed it to even to wake up and get out of bed, start moving around, take a shower. And that's when I started, stealing from my family, friends. Whatever money I had in my pocket was all going to it. If I got a $500 paycheck, $500 going to dope.
Because you always tell yourself, whenever you're using drugs, and especially it's like a super addictive one, I'm not addicted. Motherfucker, you're addicted. You know what I mean? Like, you're fucking addicted. You're in denial. You might not be addicted at that point in time, but you're gonna keep using, and a month later or 2 months later, you're fucking addicted.
At one point, my husband said he would stop putting gas in the van so I could drive the distance to the city to get my drugs. And I said, well, I'll show you. I'm going to move to the city. So I don't need my van and I don't need gas money because the dope dealers are going to be living right here with me. And that's what I did. I ran away from home.
You will be high and put yourself in situations that you will get hurt. Someone will take advantage of you. You'll be knocked out, it's gonna happen. You're gonna get hurt.
Some people who have money and they don't have to steal for it. And then you meet other people who, just pawn their family's TV and is coming to get high and then deal with the consequences later.
She stole checks from her grandmother and signed them. She stole my debit card. If it wasn't nailed down, it was in the pawn shop. She spent $800 a week. My daughter, who had, everything handed to her, could have gone anywhere in the world, very book smart, very motivated, worked at a strip club. My little girl degraded herself just to get that.
Women turn to prostitution, which I've done myself. Guys will steal. They'll rob you right in front of you. I've seen guys take guns out on dealers and steal and rob everything from them, not even worrying about if they get shot or end up in jail.
People get raped. People get killed over stupid shit. It's people now I can say it's just a drug. But like when you're getting high, it's not just a drug. It's some
Best thing that can happen to someone who's addicted to oxycodone is that they can be arrested. That's the best thing. The best thing that they can be arrested and go to jail. Everything other than that is worse. It's going to end in a bad way.
You're going to get caught eventually, so I just didn't think it was going to be me. I would just think, they must have screwed over the wrong person. They got caught because they weren't careful enough.
She was pulled over. I searched the car, and she had a quantity of pills. At that point, she was smoking them, so there was some type of a pipe device in them, so she was arrested. And she was a convicted felon at the age of 18.
I have 4 kids. My youngest son will be 1 this month. I've been locked up for freaking 8 months. First time I came to jail, the first time I got locked up this year, he was 2 weeks old. Don't even know my kid. My other 3 are in foster care right now. I never thought any of this would ever happen to me. The only thing I care about is my kids. Like, my kids are suffering. It's not me. I give 2 shits if I'm suffering. I mean, yeah, it sucks. But it's like, my kids, they didn't do anything in this. My parents, they got to come visit me through, I don't even get through a window. I get through a camera. Their little camcorder. That sucks.
It's not worth it. Losing your freedom sucks. You have somebody tell you when to get up, when to shower, when you eat, what you eat, and you have to worry about the other people that are in here and that are in here for, life, and they don't care about you.
I was supposed to go to court November 2011, and the judge was supposed to let me go. He gave me the maximum, which ended up being 23 months, 2 years instead of the 10 months. And at the time, I was so angry. In retrospect, I'm very thankful because I would have, I know for 100% certainty I would have gone right back out and done it again.
I got kicked out of my house, and I met your neighborhood-friendly drug dealers who were like, oh, you can crash on this couch. And they, of course, they'd give me stuff here and there, but it wasn't ever enough for me to even enjoy it, so that made me run fake prescriptions.
You don't think about anything. You don't think about anybody you're hurting. You don't think about before and after. You don't think 7 dudes in all black are running up in your house. You don't think you're gonna be on the news. You don't think anything. You don't think any of that.
Every generation seems to have their drug of choice. Unfortunately, this generation seems to have found prescription opiates as that drug of choice. And even more unfortunately, the consequences of those drugs are far more devastating than anything else we've seen in the past. Chemically and physiologically speaking, there's very little difference between oxycodone, morphine, and heroin. It's just that one comes in a prescription bottle and another one comes in a plastic bag.
In the beginning, I would always try and get pills because you know what you're getting, you know? You know it's always gonna be the same thing. And then eventually that just got too expensive, you know? So then you'd go for heroin because it's cheaper, but you take that risk of getting really good stuff and overdosing, or getting fake stuff, or just stuff that isn't good enough to even get you well.
A lot of my friends were trying heroin, you know, to get the same high from the Oxycontin, and it was cheaper, and so of course I got into it, and it just grabbed me, you know.
I can tell you this, that I think she was able to access more heroin easily than the pills. When she was using one or using the other, she was the same horrible, difficult person.
I always said that I would never touch heroin ever in my life, and it was prescription drugs that led me to try heroin. Prescription drugs are the same thing. It's an opiate. You can get 4 shots for the price of 1 pill, and it's a dirty drug because you never know what you're gonna get. People can cut it with something that can kill you, you know? That's how most people overdose, is that it's cut with something bad.
The doctor asked me, he said, where are you getting your heroin from? Where, you know, and I said, I will never tell you who I'm getting it from. He said, I don't want to know from who. He said, I want to know from where. And he said, well, let me tell you what you're shooting up. He said, you're shooting scramble heroin, and they are using meat tenderizer as a cutting agent. It's not like, you know, a bag of heroin comes with ingredients on the back. And of course you trust your drug dealer that he's going to just, you know, keep you coming back to him. But he claims he didn't know either. That's how he got it. But yeah, so it eats everything away underneath.
In here, they shoot a meat tenderizer, and they have like big blue black marks. I'm like, what the is that? They're like, oh, that's meat tenderizer. You've got a few of them. What do you mean? You didn't learn? You don't know. You don't learn because you're trying to get high. It doesn't matter.
A lot of my friends have had abscesses. They might get a staph infection, which turns into MRSA, or, you know, Hep C. And, you know, if that's your only needle, that's your only needle, so you're going to use it again.
At one point, I had an abscess in my leg that was so bad. I had staph infection. So my leg was like 4 times its normal size. When the doctors cut my leg open to clean it out, I had maggots in my leg. They were eating the rot, the infection. That wasn't enough for me to quit. As I was admitted to the hospital, they gave me a PICC line, which is an IV line. I had the dope dealer come into the hospital and shooting heroin into my IV line. I have contracted hepatitis C from sharing needles with people that I don't know who. I shot up toilet water because I didn't want to spend any money to go buy a bottle of water. So we would stop at public restrooms and use toilet water to mix with it to shoot it up. Rainwater on the side of the road, and you'd suck it up in the needle and shoot our dope. I didn't care what it was going to do to me later on. Just I wanted the feeling of it right then and there.
Withdrawal for the individuals that are taking the heroin that's available now looks like extraordinary physical, muscular pain. And very few people can actually manage it.
Like, you know how when your whole body hurts when you have the flu? And, like, just, it's like 15 times worse than that. Opiates, you're getting sick. I don't know who the f you think you are if you think you're stronger than some dope, because you're not. You know what I mean? Your body's gonna give in, your mind's gonna give in, your judgment's gonna give in, you're gonna bow. And that's just the way it is. That's the way it is. That withdrawal is...
You feel like you just want to die when you're going through that. At that point, you're willing to do anything to get that next high so you can just feel normal.
I mean, I remember her in her room crying and just busting her room up, screaming to me, just get me a little. Just get me a little so I can stop. No.
It feels like your skin's crawling and you can't sit still and you'll do anything to make it stop.
You can't move. You constantly sneeze. Your fucking whole body aches. It hurts. People are crapping on themselves. People are puking on themselves. People are doing both at the same time. You would probably rather be dead than have to actually go through a withdrawal.
It was horrific. I was sitting on the toilet, diarrhea, vomiting on the floor, so weak I couldn't even move. I just lay there like, I don't want to eat, drink, nothing.
It's just something that I never ever want to experience again. It is the worst feeling ever. And I wouldn't even, I wouldn't wish that feeling upon my worst enemy. That's how bad it is.
Every day I come to work knowing that somebody died. And more times than not, we have at least one prescription drug or other substance abuse case. Your friends, your family will find you dead, and then what happens? And then that is the image that they get stuck with for the rest of their lives.
I've lost several friends to heroin and prescription pill overdose.
I know 2 people on a personal level that had died from it.
You know, one time my friend, she got out of here, she got high. She wasn't even out 6 days. She was dead.
One of my friends, she took her normal dose and OD'd. Her sister found her with a needle in her arm in her room, which was not good.
The day that I overdosed, I was having a hard time finding a vein, and a girlfriend of mine said, well, just go in your neck. You have your jugular vein. And I said, okay. It didn't let me push all the heroin in, and instantly it killed me. When the ambulance got there, they gave me a shot of Narcan, and I was non-responsive to the Narcan, which is adrenaline, and that's to, jumpstart your heart. And it didn't work. So they had to use the defibrillator, and that's where they shock your heart back. They got a pulse. They got me to the hospital, and I was still kind of in and out of it. But when I came to, I unhooked the IV from the pole and unhooked all these little things they had on me, and I went and walked right out and got in my van, and I showed up to the dope dealer with the gown on, these things stuck all over me, the IV in my arm, and he sold me heroin, the same heroin that just killed me. I utilized the IV a couple times before I turned it back in, because I have nowhere really to shoot, so that was a freebie.
So everything came to a head. I was writing the prescriptions and full on with my addiction, and I ended up getting caught and going to jail. And while I was in jail, my daughter got involved with some friends. From what I understand, her friends were all doing prescription pills. I had no idea. I didn't even know it was a problem. I just thought it was my problem. And she said, Mom, you don't have any right to talk. Look at you. Look where you are. I said, but Kirsten, you saw where it put me. I can't imagine you would do the very same thing that I did. I'm like, how? You know, it just didn't make sense.
My mom, I would go to the doctor's office every time with her. I told her I'd go in for her, and usually it works because she'll go in for me and ask for my prescriptions, and they give it to her. And so I went in there and I asked, and next thing you know, she got arrested, and then she called me saying that I had a warrant for me. I said, why would you make me go in and do that? Like, to your own daughter, knowing that she can get caught and get in trouble. And she said that she was sorry because that she didn't realize how bad her addiction was.
You need help, Kirsten?
When I talked to her, she didn't even say goodbye. She must have nodded off the phone because I heard like and that was it. It was Saturday afternoon. I was in the jail and they came down and told me they needed to see me. And I went up and because her father and I were both arrested for the same thing, we were both there, so I saw him coming. And the detectives came and told us that she, what had happened. The parent overdose and that she was, initially they said she'd passed and then they said she was in ICU, struggling for life. And they wanted me to talk to the doctor, and the doctor recommended I disconnect all life support, and I refused. And then they had 7 resuscitation efforts, I guess, and eventually, that morning she passed away. So. At her funeral, most all the kids were high. Death is real. And I will say, because I remember being that teenager too, so I know it's like they're gonna mock it, but it's real. And I think I'm still in shock. Like it is hard. I don't even know how to put it into words. Maybe that's why I'm able to deal with it, because it's so mind-numbing that someone you love that much. She was my first love. Someone you love that much, you can lose like that, and you can't go back and say I'm sorry or set a better example or talk them out of it, and I know she didn't want to go. I know that's not what she wanted. I know that she had, all these things that she wanted to do, and I know that as they resuscitated her through the night, that was her way of clinging to life, But it was too much.
I love my children more than anything in the world. I will walk through fire for them. And I know a lot of parents feel that way. But you can't feel that way. You have to understand what you're dealing with is not your child. I put my own child in jail to stop her from this. And that's not an easy decision to make. It's not a fun decision. Nobody wants to know that their little girl's sitting in jail. But she was 7 months clean, eating healthy, getting her rest, no drugs. My son, my nephew, my mother, and I went to get her. And she came out and she was healthy. Everything was great. Everything was great. There were no problems, no fighting, no talking about, Mom, I'm feeling funny, I need to go to a meeting. Nothing. Everything was just that little girl at 16 before all this stuff started. That's who she was. And then she asked to go to the store to get a pack of cigarettes. And she came home, said, oh, Mom, I'm sorry I was late. They didn't have my cigarettes. I had to go to another gas station. Okay, and thing's fine. So I'm cooking dinner, and I'm like, you want to help me cook? She's like, no, I don't want to help you cook. So I'm going to go in my room and watch TV. And she was so bubbly, like nothing. Nothing was wrong. And she went upstairs, and it was maybe 40 minutes. I was cooking dinner. Dinner was done. And I'm hollering for the kids. My son and nephew come down, and Sierra didn't come down. I think she fell asleep or something. So I go upstairs and knocking on the doors, no answer. I open that door, and my little girl is on the floor dead. And I remember when I pushed on her chest, I heard that last breath. I heard the... I was in my kitchen cooking dinner, and that happened 17 steps up, and I had no idea that when she left this house, that was gonna happen. And I spend my Sundays looking at a gray headstone in a patch of grass. I will be spending my Christmases there, her birthdays there, all my holidays. Because she took that wrong turn.
My girlfriend, Sierra, you know, she passed away a year ago this month, and from heroin. And, you know, that's a constant big reminder in my head that, you know, if I even pick this stuff up once, it's gonna kill me, you know? And there's not a day that goes by that I don't think about her. And, you know, not a morning that I wake up that I don't wish that she was laying beside me, you know? She was my best friend. We went to high school together. Sorry. I met her in high school. I'm sorry. I just miss her a lot. I wish she was still here with me.
Sierra came home on February 12th. Sierra died February 18th. And she got out. It's still calling her. Still calling her. It's that powerful that you could spend 7 months clean, and being educated on nothing but how to beat it, how bad it is for you, you know, all this. And you last 6 days.
The spiral down is so fast, you know? It doesn't take much. And I lost everything. I lost my daughter, first and foremost, but I lost pictures, every material possession I had. I had never been in trouble in my life. I'm now a felon at 41 years old. So all that work I did, you know, all those dreams I had, you know, it's like I'm starting over again with a huge weight on my shoulders, you know, all for a pill.
My dad doesn't even trust me anymore, which is hard because my dad's always trusted me my whole life. I've never had my dad look at me with disappointment before I did this. I'm a criminal, I'm an addict. That's how everybody will always perceive me. Listen to what they say no. Just say no. You're not uncool for saying no. You're more cool for saying no, I think. I wish I could have said no. If I could go back and do it all over, I would definitely go back and say no.
I didn't feel like I was physically hooked, but that's because I never gave it a chance to stop. You know, and I didn't really learn how to enjoy life without drugs. As much as I wanted to quit, I was too scared to ask for help. I don't want to freak my parents out by telling them I'm hooked on some hardcore drug. It didn't kill me like everyone told me.
It's not worth it, and it will get you. You're no different than anybody else. It will destroy your life. You will end up in a jail, you'll end up dead, or you'll be in some crazy institution for the rest of your life. And that's serious, and that's for real. And it took me coming to jail and being incarcerated. And it took me missing my mom's funeral, missing my children grow up. It's taken all of this, because nobody in their right mind would turn their back on their dying mom for a drug. I want to be that loving and caring mom that my mom was to me, to my girls. I don't want them to hate me, to resent me. I don't want them to be embarrassed by me anymore.
If you want to fail the rest of your life, if you want to be in and out of jail, if you want to possibly lose everything that matters to you, go ahead and go get high. Go ahead. If you want to be happy, you want to freaking get married, like every good part of my life, I wasn't getting high. You know, every good part of my life, I was getting high. And any drug addict will tell you that. If you want to be a flunky, go ahead and get high. Go ahead and do it. But I've been there, done that, and I wouldn't recommend it.
Sierra did not take life for granted until she started using. It is much stronger than you, and it will win. It will win. Because this doesn't just affect you. It affects everybody in your family for the rest of their lives. That we're the ones stuck here, missing you. And there's help out there. You gotta take it. Don't think you can do it alone, because you can't. And your parents aren't the enemy. They just want the best for you.
It's something I want to deal with for the rest of my life. You know, to be honest, I actually just relapsed about a month ago, and used for about a month, and I have a week. I had a week clean on Wednesday, and you know, that's something that just shows how powerful this disease is. For me to lose somebody a year ago, not even a year ago, but I'm already using it. That's how powerful this stuff is. And, I'm just gonna try my best to stick with it, because I know it will kill me. And just something I gotta work at every day. It'll take you to hell and back, and if you're lucky, you know, you'll make it back, you know. It's just not worth it at all, you know. If I could go back, if I knew what I knew now about this, and if I could go back, I would do it all different. Starting with that first pill, I wouldn't touch it.
I'm going to ask our panelists to make their way up on the stage, please. And as they're doing that, as you arrived, you should have received a square piece of paper to pose your questions on. So if you have those ready to go, we have a few people in the audience who will come around and collect them. You just have to kind of raise your hand up and they'll come collect them from you. If you need another one, we have more. And you can fill out as many as you like as we go through this process. So do I have my moderators? Yeah. And I'm going to have each of them introduce themselves before we get started. We'll start with Gail, and you can just take that mic. Yep. Yes.
Hi. Hi, my name is Gail Crooks. I'm the Director of Spotsylvania County Department of Social Services.
Hi, I'm First Sergeant Woodard. I work in the Criminal Investigation Division with Spotsylvania County Sheriff's Office.
I'm Greg Litz. I'm the Division Chief of Emergency Medical Services for Spotsylvania County.
Hello, I'm Dr. Thomas Jordan. I'm a psychiatrist at the Rappahannock Area Community Services Board.
Hi, Mike Barbuti. I'm the Assistant Special Agent in charge for the Drug Enforcement Administration in Richmond.
Hi, my name is Elaine Westcoat. I'm a licensed professional counselor, licensed substance abuse treatment practitioner in private practice here in Fredericksburg.
Hi, I'm Dana Brown. I'm an author and a speaker. I'm an ex-addict of 14 years. I've been free for addiction for all that time. Now I'm a wife, a mother, a speaker, and an author. And I can relate to just about every story that you guys just heard in that film.
Okay. You want to pass that back? And then you guys use this one. Sure. Okay, we're going to start with a preset question, and then as the moderators get their questions, if you can just bring them up and lay them on the stage or hand them to me. So how this will go is I'll ask a question, and if you want to answer, please do. If no one speaks up, I'll call on you, like school, and we'll and try to multiple answers are very welcome from different perspectives. It's helpful to the audience to have that as well. So the first question we'll ask is, what's the most effective treatment option for opioid and heroin addicts?
Again, my name's Elaine Westcoat. I've been treating addiction, actually dual disorders, people with addiction and mental health conditions for 30 years. The first thing that has to happen for those folks tends to be getting them away from their use. And even though the withdrawals are incredibly uncomfortable, very painful, their hair hurts, clothing touching their skin hurts, they will not die. And the withdrawal process is difficult, very uncomfortable. Depends on where they go for the withdrawal detox to determine what is done to handle that process. Usually doctors prefer little intervention just to help ease the discomfort, but help them get through. But the philosophies are changing. The other part that's significant to treating addiction, especially with the opiates, is long-term treatment. Ideally, they would go from detox to a residential treatment setting for a minimum of a month. And ideally, they would go from there to a halfway house for approximately 6 months to a year, depending on the person, their resources, and what's available. After halfway, then they would go to an outpatient treatment setting for ongoing monitoring, aftercare programs, and 12-step involvement is included in the entire treatment process.
Agree with everything that she said. Also, I believe that in the 12-step program, when you're choosing a higher power, if you choose a higher power that's standing still, you're not going to go anywhere. Chasing the Dragon is a great title for this movie, because you are seriously chasing something every day, every moment of your life, and you can't just stop chasing something. You have to have something in that place. And so in the rooms you hear about a higher power, but if you have a higher power that's standing still or not going anywhere, you will stand still and not go anywhere. Choosing a higher power that will lead you in the opposite direction is imperative. You have to find a higher power whom you can follow.
Disposing of meds can be difficult. How often are Operation Medicine Cabinet events or how often do they occur? I've seen mailboxes in Walgreens, CVS, et cetera, in other states, but why not in Virginia?
There's one in the front lobby of the Spotsylvania County Sheriff's Office. You can bring any narcotics you want and drop them off. It's a secured box. We received the box from CVS. It's mounted to the floor. We clean it out, and we have a disposal process. But we do have one at the Sheriff's Office that people can bring any old narcotics or pills that they want to dispose of and drop off and put them in the box, no questions asked.
I just want to echo that. Like the first sergeant said, they have the box in the sheriff's office. DEA sponsors their National Take Back Initiative Day twice a year, once in the spring and once in the fall. So that's coming up on October 28th, which is a nationwide effort on Saturday the 28th from 10 to 2. We partner with about 4,000 law enforcement and community groups around the country to provide a safe, anonymous place for everyone to come and dispose of their unused or expired or unwanted prescription drugs, no questions asked. And again, so that'll be Saturday, October 28th. You can go to dea.gov and find, put in your zip code and find the location closest to you. And again, that's something we do twice a year. But as was mentioned, there's a lot of police departments now and drugstores that are starting to put these disposal boxes in their police departments all year round, which is fantastic.
There's a question as a follow-up to that. Why shouldn't anyone flush the drugs or put them down the sink?
I'm not into water treatment specifically, but I've treated somebody who was into water treatment. The water cleaning systems are not designed to clean drugs out of the water. And I was told, I don't know if this is true, but I was told that fish in the Rappahannock were testing positive for drugs. Therefore, if a person were to dispose of their own limited amounts at home, it is advisable to put them in wet food like coffee grounds that you are throwing away, so they cannot be retrieved out of the drugs, nor will they get into the water system.
There's several questions about pharmacies and physicians overprescribing and pushing medication. Can you all address that in any way?
So I'm a psychiatrist, so luckily I do not prescribe hardly any opioids at all. However, my colleagues in multiple different medical specialties do prescribe opioids. There is a lot more physician education now than there used to be about kind of responsible prescribing practices. That continues to be a problem for the patients that I see, if there's kind of a problem that I'm seeing in the prescribing pattern, I'll reach out to their physician and say, I need to collaborate about this, person's prescriptions. In our country, the physicians do have a lot of personal leeway to do that until they get on the radar of the DEA's radar. So I don't have a great answer to that question.
I believe that the DEA has more direct influence with the doctors and of monitoring their practices necessarily than we do on the local level. However, we do have people that work on pill cases and diversion cases, which is overprescribing, but usually it's in conjunction with another federal agency.
I just kind of want to speak to the supply and demand aspect of it. There are many, many people who can go in and get prescribed an opiate and use it as prescribed and walk away from it. The majority of what I believe happens are people who have deeper hurts, deeper pains. They find that this opiate takes away that emotion that they're not, that they don't want to feel. And that is kind of a stepping stone, not for everyone, but for many. And so I believe that if there wasn't such a demand, we wouldn't need such a supplier. There wouldn't be as much over-prescribing. And so prevention is imperative. We have to find out what's going on with our kids. We have to find out if our children are depressed. We need to not hide in shame. This is not something to be ashamed of. This is something that can be helped. And it can be helped before we have a problem, before that child breaks their arm and finds an opiate that takes that pain away. And so I believe getting to the root of a problem, it's not going to solve the entire problem, but I believe it's a huge step in the right direction.
Well, I know DEA was mentioned, and DEA does have our Office of Diversion Control. So in addition to being a law enforcement agency, DEA also has regulatory functions where anyone who is authorized to prescribe or distribute a controlled substance in this country is registered with the DEA. And DEA has investigators that conduct investigations of doctors who may be overprescribing or pharmacies who are not reporting and doing their due diligence and reporting suspicious orders or things that look like forged prescriptions, or seeing patterns where they're seeing repeat customers that they know should be reported. And also drug distributors and manufacturers also who are licensed to distribute to pharmacies. And like I said, there are, I think, a couple million registered doctors and pharmacies in this country, the great majority of which are trying to do the right thing, are legitimate medical practices, but the ones that usually get targeted or prosecuted are just so egregious. And again, I don't have statistics here for you, but the numbers are really over the top, as far as a pharmacy in a small town of 5,000 people receiving and distributing enough drugs for a population of 500,000 people. So things like that, when they come on our radar, they get investigated and prosecuted. And we do have an arm of the DEA that is charged with doing that.
This is coming from the live stream chat. After reading about law enforcement officers and medical personnel being exposed to drug powder, how can we protect our children from secondhand exposure such as this?
I'm sorry. So I think you probably see publicized incidents around the country of law enforcement officers and first responders coming in contact with deadly fentanyl. Usually is the case. Like I told you earlier, there's 2 to 3 milligrams is enough if inhaled or ingested or absorbed through the skin. It could be airborne and ingested or inhaled. And first responders have come in contact with this and have had medical reactions to it. We are now carrying, as federal agents, we carry Narcan now ourselves, not because we're first responders and because we're likely to come across an overdose victim in our investigations, but for our own protection, because we're doing investigations in a search warrant where you may come across a quantity of fentanyl, or do a car stop where there's an unknown white powder gets on you accidentally, and our own people could go down. So we carry that largely for our own protection. The one thing I would caution and say as a kind of a public safety thing, and a lot of times I think as a family member or a loved, like I said, this stuff is deadly coming in contact with it. It could be. So a lot of times when a family member or a friend, finds a loved one who has overdosed and they go to call 911, and sometimes their first reaction is to, well, let me clean up the scene first so they don't get in any more trouble, or so I don't get in trouble because there's a needle here or there's extra powder here, and I don't want the police to come and get in trouble. And I caution you to please not do that, to not disturb the scene, not to touch what you don't know what you're touching and getting into, because you could accidentally expose yourself trying to help that person. And I'm not saying not to administer medical care or aid or call 911, but just be very careful for that secondary exposure, for attempting to think you're doing the right thing by maybe moving things around or cleaning up the scene, and you yourself could accidentally come in contact with this very deadly substance. So
I'd like to add on to that. When people take time to clean up the scene, it also cuts down the response time for both fire and EMS. It could be 2 or 3 minutes, and that's 2 or 3 minutes that someone may not have the time. Their life's in jeopardy, and the quicker we get there to administer Narcan, the better off the person is, and the higher the chances of them reviving are. So by cleaning up the scene also, it decreases our time and puts the victim out there even longer, which potentially could cause them to ultimately pass away.
I think part of the heart of that question was, how do we protect our children? And I think that starts with having that conversation, not just about what being directly involved with the drugs can do, but also being in the environment and what to be aware of. So start your conversations early and start them honestly, and so that the children themselves know to stay away. Because the best way to not be exposed to it is to not be near it.
There are several questions asking about treatment facilities that may offer a reduced rate, or if someone isn't able to afford treatment, are there other options or other resources that they can access to get help?
Hi, so I do work at the Community Services Board, so we serve folks there regardless of ability to pay. We have sliding scale services for folks. As part of the Community Services Board, we do have substance abuse counselors, substance abuse coordinators that actually work with folks in Spotsylvania County, as well as in the Fredericksburg City, Caroline, King George, and Stafford counties. As far as, and that's really kind of the first line way to go about things, is going to the Community Services Board and seeing which services are appropriate for that individual. There are a number of other private providers in the area also that may also have a reduced cost or sliding scale fees.
One of my clients' the parent is my client, and they recently told me about successfully getting their adult child placed by just calling treatment program after treatment program after treatment program and asking for scholarships, asking for help, asking for financial assistance. It would take a lot of phone calls, but I would think it would be worth the fight. Other than that, it's about going through the insurance companies, but it's hard to find, and insurance companies are very restrictive, so I think you'd have a better shot going through the treatment programs themselves. A lot of them do have scholarships. A lot of them have resources available that their alumni contribute to, so you never know until you ask.
Since I've kind of gotten into the arena of speaking and getting a little deeper into what's happening and how we're handling this situation, I have found many parents of children who may not have made it out alive who have started foundations. There's one called Realty for Rehab, and they are a group of realtors who give a percentage of their profit, and there is money available when someone needs to go into a rehabilitation center immediately. Because it's true, it is difficult to get in, it is difficult to deal with the insurance companies. But the more our community gets involved and has a heart for this issue, because it could be any of your kids. I came from an upper middle class family. My best friend was from one of the wealthiest neighborhoods in our city, and we wound up in New York at Sarah Lawrence College at a party that was flooded with heroin. And it could be anybody. And so if you have connections and you're a realtor or whatever, and you have people that you can talk to that want to help, our community has to come together to help. We are in a fire. We're in a fire, we're trying to put it out, but we also know that we can't sustain the growth that's happening now with treatment centers or prisons. It can't happen at the rate that we're growing in this issue. We have to start with prevention, and we need the community's help.
Yeah, and just one more thing. So you had mentioned the inpatient treatment facilities, which do have the highest rates of success out of kind of different treatment options, is being completely removed from your environment for at least 30 days, if not 60 or 90, kind of usually the longer the better. However, those places are very expensive, and the best way to get into one of those is for charity beds or scholarship funds, like y'all mentioned, absolutely. The jail has also been a de facto treatment center because we talk about removed from your environment for 30 to 90 days. That is a jail stay also. Unfortunately, that has become a lot of the treatment setting for people who can't afford it anywhere else and end up getting arrested.
Yeah, I used to call prisons, detoxes, and rehabs my moments of clarity. daily it was get money, get drugs, get high. That was my focus all day, every day. I wouldn't sleep for days. I was an intravenous heroin cocaine user, and I was also addicted to needles. But when I wound up arrested, or if I wound up in a detox or a rehab, I could actually have some time to think about what I was doing to myself. And so don't bail your kids out.
To add to what you've heard, the reason the treatment needs to be so long is, and the video did say this, the brain is changed from the drugs. So treatment has to be long-term to teach them how to change their brains back. And it takes a long time. The brain also has to recalibrate the neurochemicals that the drugs directly interfered with. But this takes a lot of restricted environment, repetition, and gradual exposure. And that's part of why I prescribed the treatment modality that I did, from detox to acute, residential to halfway house to outpatient, because it has to take that long a time. You heard about people who were in jail and came back out and used. If the brain doesn't change, the pattern won't change.
There are a lot of questions in here about prescribing, doctors having training, and why it's up to the DEA to control what's happening with prescribing. Are they getting training? Are there any incentives or protocols that doctors receive to order the opioids? Or is there an incentive for doctors to reduce the amount of opioids they prescribe? I don't know if anyone can answer that.
What I can say is, DEA is not DEA's function to tell doctors how to prescribe drugs or how much to prescribe. We are not medical professionals. We have stepped up our efforts at education of both doctors, pharmacists, et cetera, about prescribing practices and making them aware. As my understanding, like the doctor said earlier, that in recent years, doctors have received more and more training in pain management and prescription practices, much so than they used to in the past. I know the Centers for Disease Control, the CDC, came out about a year ago with some new guidelines for doctors when thinking about prescribing pain medication, alternatives to opioids, for example, different things. If you look at it, this has not happened all around the world. The U.S. is like 5% of the world's population, and we use something like 80 or 90% of the world's hydrocodone and oxycodone. So there are other ways in other countries, in other medical professions, that people are getting treated for pain. And that's something that the medical community has to look at, and we need to look at alternatives, and that's, I think, being done now more than ever.
Another thing that the doctors have available, whether or not they use it, and the pharmacists also have available, is the pharmacy monitoring program. And there are specific protocols that are recommended the doctors use for pain management. More and more, the monitoring is coming down on more alternative medicines and alternative treatments. I know when I work with addicts and alcoholics with chronic pain, part of my process is helping them learn to accept it, because some conditions are going to be painful, and the attitude is part of the biggest adjustment that each person has to make. But the doctors and pharmacists have access to the pharmacy monitoring program to see how much has been prescribed, whether anybody else is prescribed, and to make sure that there's not overprescription. Whether or not they adhere to that process is an individual choice. To my knowledge, Dr. Jordan might know differently, but to my knowledge, doctors are not mandated to use that resource.
Yes, in some states, there are state laws that require a physician to check the prescription monitoring database if prescribing a controlled substance for more than a week. I don't believe that's the law in Virginia. I check it for each person that I even suspect of being prescribed a controlled substance as part of my regular practice, but I'm a psychiatrist, so I'm actively talking to folks, to almost everyone I see, about substance use because it is so prevalent in our community. As far as physician education about this, the state of Virginia has now required that all physicians go through additional hours of training in order, specifically about substance abuse, to renew their license in the coming years. That amounts to about 2 hours of training So it's not much, but the state of Virginia is saying you have to have this to renew your license.
How often do you hear about or find out about farm parties, and how real are these parties?
We hear about them, but not very often. I heard of one the other day that happened about a year ago. It's usually on the high school level, but it's not something that we hear about tremendously. Very few in Spotsylvania that I've heard of.
Just to add, so that the audience is on the same page, a farm party is spelled PHARM, and it usually is adolescents, and they go clean out whatever drug cabinets they can get to and throw it all in a bowl, and they don't even know what they're taking. In my career, the scariest substance abuse assessments I do are always teenagers. They don't know what they're taking.
How can you tell if someone is using these drugs? What are the early signs, and how can I help?
Well, if it's your child, you can tell when there's a drastic change in their character, when they start to isolate, become depressed. They may change friends, their grades will begin to fall. These are all red flags, like serious red flags. For my children, we started to notice that with our oldest adopted child, and being an ex-drug addict myself, I recognized a lot of symptoms, and I drug tested her. We are not to be their friends until they're 30-something. We are to be their parents, and she didn't like us for a while because we drug tested her, and that's because her drug tests were positive. She knew we were drug testing. We took her car and sold it because she doesn't need a 3,000-pound projectile to be driving around Fredericksburg while she's using drugs. Today she's clean. We adopted her 5 years ago. I think this went on for a couple of years where we had natural consequences, and she's now in Germanna. She's doing very well. She's clean. So, I mean, you know your kids. You know your parents. I'm dealing now with a 16-year-old girl whose father is an addict, and she's desperate to help him. But you know when you see a drastic difference in someone's character and the way that they behave, the things that the people they're hanging around, just trust your gut. If your child is a minor, test them. Tell them you love them and test them.
The other thing I would add to that is don't ever take their word for it. So many parents want to believe, oh, it's just a phase. Oh, they'll get past it. Oh, everybody goes through this. No. I like Bonnie Fife's philosophy, nip it in the bud. Because it will snowball out of control. And just like you saw in the video, so many of them started with just marijuana. It can progress. It's not that marijuana is necessarily considered a gateway drug. That's an arguable concept. But it's the mindset that goes with it. And their guard is down. And so they're high on one thing, and the other thing doesn't look so bad. And so whatever you might have taught them, keep giving them the message. And like she was saying, any dramatic change, their secretiveness is a big tell. So don't take their word for it.
I'd like to jump in here as well. Last time I checked, I know my two kids don't pay rent, nor do they pay my mortgage. So the house is mine, and everything in it's mine. Their car, then that's mine too. And parents these kids feel entitled. It's your house, it's your rules. You pay the rent, you pay the mortgage, wherever you may live. Their room is not sacred. You can take the door off their room if they decide to lock it. If it pops out. If you have trouble, call us. We'll come over and show you how to do it. It's a screwdriver and a hammer, and you just pop the two pins out. But you need to go through their stuff, their cars. Their cars, their drop ceilings in your house, their clothes, their pockets when you're washing, their wallets. It's all yours. You own it. Until they're 18 and they start paying bills, they're under your house. You need to be in their business, and You know, I try to tell parents all the time, you know, get in their business and be in their drawers. You might find some things you don't want to find. You may have to overlook some things, but, you know, but, you know, if you start finding drug paraphernalia or drugs or things that are, you know, inquisitive to you, that's a problem, and that's a sign, and that's where you need to jump in. But you need to be going through their stuff.
And we were talking about minors, but if your child is still living in your house and they are 19 years old, that is still your house. And this, or 26 or 33 is when, yeah. So yeah, it's your house, it's your rules, and they are an adult. If they can't live by those rules, they're free to live however they want to outside of your house. And don't feel bad about that. You cannot love your child to death. You have to love them to life. And sometimes it's the hardest decision that you have to make, leaving them in jail, not bailing them out, not sending them money for food. All of that stuff is going to be really hard because you feel guilty. It's your child. They're manipulating you a lot of times. So just understand that you have to stand firm, and it is the best thing you can do for your family.
The mother on the video, I think her name was Trish, Sierra died. She made it very clear too. If your child is using drugs or alcohol, you're not dealing with your child anymore. They are a totally different person, and you're dealing with the addiction. It is like a totally possessive monster. I've always said that if addiction had a motto, it would be divide and conquer. And some of you, unfortunately, probably already know what I'm talking about.
And just sort of to piggyback on what the others are saying, I think the bottom line, what you're hearing is you need to call it out when you see it and not turn away from it. And that's whether it's your child, whether it's your friend, whether it's another family member. You need to call it out, and then don't do it alone. I think one of the things we see in the social services program is we have a lot of children. We see a lot of the families who are having to recover from the devastation of the introduction of drugs into the homes. And the ones who are most successful are the ones who have a network, a support network. You saw it in the video of the young man, and those final two lines where it talked, thanks to the very strong network of family and friends, he's been clean for 2 years. So work to establish that network. Don't be afraid to share your story with those who want to help you and support you, and seek that out, so that, because you're going to need the help too.
I would add one more thing. It is possible to love your children to death if you turn a blind eye to this, if you buy their excuses, if you make excuses for them.
I've heard the statement. I thought that it was just a phase and that they would grow out of it. There is no phase with heroin. They don't grow out of it. They either go to rehab and get clean. It's a long-term life endeavor. I think there's some people in here that will attest to that, but the flip side of that coin is death. And that's a reality of it. And I've had that said to me. I thought it was just a phase and that they would grow out of it. There's no such thing with heroin.
The number of seniors who are now addicted to opioids is steadily increasing. Are there any efforts by Spotsylvania County to address the need specifically for seniors? Also, if any Narcan training for seniors, is there any Narcan training for seniors planned, or Revive training?
I'll answer collectively for. Go ahead, Michelle.
Sorry, I'm behind the scenes tonight. Michelle Wagaman, Rappahannock Area Community Services Board. There's a Revive flyer. As you leave here tonight, there are 3 community trainings coming up for Revive, and that is it's a 90-minute training where lay people, you, me, can learn how to recognize an opioid overdose and then how to safely administer Narcan. And we have partnered with the Health District to provide free Narcan to people who have completed the Revive training.
Thank you, Michelle. Does Narcan work on the drug Flacca? I don't know if I'm saying that right. If the person overdoses on it.
I believe Narcan only works for opiate-related drugs.
Are there any legal repercussions after a person suffering addiction receives a Narcan dose by first responders answering a call for overdose, can he or she be held for recovery services as an involuntary inpatient?
In order to keep somebody against their will in a treatment program, they have to be at risk of hurting themselves, somebody else, or completely unable to function. And unfortunately, alcohol and drug use do not qualify for any of those.
I believe that it's already been stated tonight that nobody in law enforcement that I've come across believes that arresting our way out of it is the answer to the problem. However, sometimes that is an answer to save someone's life tonight. Whether or not it's the right thing or the favorable thing to do, sometimes that's what we have to do. If I know that I put somebody in Rappahannock Regional Jail, at least I know they're safe. They're getting medical treatment and they can't harm themselves. The problem with Narcan is that it's very short-lived. We can administer Narcan to someone. They can go to the hospital AMA, which is check themselves out against medical advice, and walk out of the hospital. And potentially the drug can reactivate and they can go back into an opiate epidemic again after they leave. So we try to escort them as best as we can to the hospital, but they go back out, they still have the opiates in their system and they reuse again to get high, to not be sick. They could potentially be harming themselves again, even worse at this point. So sometimes jail is an alternative until the family or they make the decision to get themselves in a rehabilitation center.
Okay, we're running close to 8:30, I believe. Last time I checked. So we have a couple more questions there. You all asked some really good questions. We weren't able to really get to all of them. Hopefully we got to most of them, but there's a couple others that I think are important to ask. And then if you all want to start thinking about if there's a summary statement you'd like to make to the audience, then you'll have an opportunity to do that. What are the impacts being seen from the first responder perspective? I think this is what you all are seeing in the field.
Well, I can speak of the impacts just since I've been here tonight, and we've already responded to 2 opiate-related overdoses in our county just in the time that First Sergeant Woodard and myself have been here. So it's a cascading problem in that, when you're responding to multiple calls like this today, it uses not only the 911 center resources, the sheriff's office resources, all of our emergency medical service resources, but then it kind of cascades into the hospital setting as well. So it does impact our system and impacts our responders. As some of you may have been impacted yourselves, that this crisis impacts our psyche, if you will. That when you see young, otherwise healthy people that you respond to and you do your best, and we're trying to do everything that we can to revive them, and we don't. That's something that we take home with us as well. So we're doing our best to address from an emergency response standpoint. But I think the best thing we need to really focus on, from what I've gathered tonight, is prevention.
From the law enforcement side, real quick, the numbers, and it's bottom line, it's fact. 33 in 2015 overdoses with 9 fatalities. 2016 we had 82 overdoses with 24 fatalities. 2017 we were up to 118. That's just heroin. That's not counting the pills. If you count the pills in there, the opioid-related pills, we're at about 139. With the ones that came in, I gave the numbers Friday. They changed till Monday morning, this morning. If I would have gave them at noon, they changed on the way here because we had one before I got here, which it's steadily rising. So the law enforcement we're responding to a significantly higher number daily.
I know many people don't think of social services as being in the area of first responders, but our CPS, our Child Protective Services investigators, are frequently called out. And I'll just say in fiscal year 17, there was over 200 calls of the over 1,200 that we respond to. Over 200 of them involved substance abuse, and over 89 of those were heroin and opioids. And that directly impacts to the welfare of our children. And a number of those children then end up coming into care, but that's what we're seeing on the first line as well.
Are methadone and Suboxone clinics helping the addict? Can they continue using while going to clinics? Are they changing one addiction for another? And is there any education on the use and abuse of methadone?
So for those of you who don't know, methadone and Suboxone are the two treatment modalities for opioid use disorder that involve using an opiate itself. So methadone and Suboxone are both opiates. Methadone has been around a lot longer and does have more addictive properties than Suboxone does. People can definitely try to continue using. It is very dangerous to continue using on either of those substances. They are regularly drug tested to try to prevent that from happening. It can be very dangerous to combine those medications with other opiates or other recreational drugs.
Including alcohol. They're not supposed to drink when they're taking Suboxone.
Yes, that's actually probably one of the major causes of overdose is to combine the opiates along with alcohol or along with a sedative type of medication. There was a lot of that question that I could probably talk for the next hour about, but.
Thank you. So the final question, I think, which will be helpful is, why is it so hard for addicts to get the help, who want it? And I think another part of that would be, what are the signs that people should look for to tell if someone's addicted?
So what addiction is at its core is using a substance so much that you have loss of control over that substance. And so with that loss of control, you start prioritizing your time and effort and willpower all toward that substance and not toward the other things in your life. And so the other things in your life start to diminish, like your social interactions. Your friends may change to friends who help you get the substance. Your grades go down, as we had mentioned before. It is very difficult to get help. Oftentimes, people with addiction, when they are ready to get help, they want to get it immediately, and they need it immediately, and that's not how our system responds. We're very good about getting folks kind of emergency medical care that need it, but when folks need to be kind of emergently entered into a substance abuse rehab program, that doesn't happen emergently, even though it can be the best thing they need at that time.
One of the things I would add to that process is helping them understand they will not die in withdrawal from opiates. And it'll be very uncomfortable, but they will not die. So, yeah, it's going to take some time to get the ball rolling, put the pieces in place, and their resources are available. But just like was referenced in the video, surrounding somebody with others who can support them and care about them can be incredibly useful. Any of you who have interest, if you want to understand more about why this is so hard for them to quit, I strongly suggest you look at YouTube under Kevin McCauley. He has 3 videos online that are very useful and very thorough in describing the changes in the brain and why this is indeed a disease and what has to happen in order not only for the addiction to take hold, but the changes that are going to be required to help the person get back to a clean and sober lifestyle if they choose to. Kevin McCauley, it's McCauley.
All right, any other follow-up statements from the panelists that you'd like to share? Not required, just asking.
Is this our wrap-up question or just what we'd like to end with? Sure. Being an ex-addict for 14 years, I decided that it would be helpful to write a book. I wrote a book. It's called Desperate for a Fix. I want to just kind of give you a glimpse in what it looks like to be an addict. Now, you got a lot of information on the film, but the best way that I have ever been able to come about describing the feeling of being on heroin or an opiate is what a baby must feel like in its mother's womb. You're safe, you're fed, you're warm, Nothing can hurt you. It's just an encasement around reality. And so that feeling it's really hard to not want that all the time, especially if you have trauma or if you've had any mental illness, anything like that. So I wrote a book, Desperate for a Fix. You can speak to me out in the foyer. It's a walk through my brain for about 9 years of homelessness, prostitution, cocaine and heroin addiction while I was on the streets of New York City. A lot of things happened on the streets up there that pushed me forward. And part of the problem is when you want that help right now and you can't get it right now, and you know that you're not going to die, what you experience is the only way I can explain it is a mental raping of your brain. It is unwanted thoughts that are bombarding you constantly, and you either give in or you continue to be mentally raped. It's really, I can't even tell you how difficult it is. And so that is why prevention is just so very important. Thank you all for coming.
And my final statements, I would just like to encourage all of you not to let your conversation end tonight. Don't let this be your last connection to what's going on in your community. Take the conversations back to your home. Take the conversations back to your faith-based groups. Take the conversation back to your civic groups. And then be open to becoming part of the solution, whether it's organized as part of a prevention front, advocacy, maybe being part of someone's support network, learning more, and don't be afraid of this in that that you're afraid to engage. Look it straight in the eye and start taking this on before it overcomes our community altogether.
On the treatment side, I would add treatment does work. They have to follow through. They have to do what we ask them to do. It does work. There are lots of people in recovery. Alcoholics Anonymous, Narcotics Anonymous are everywhere. The larger the community, the more meetings there are. There are open meetings anyone can attend. You can learn more there as well. Treatment does work. They have to follow through. We're available. It does take resources to put it in place, but it can help.
From the sheriff's office side, I would just encourage everybody that if you go back and you're speaking to people in your family, your community, your church, social arenas, whichever you may be involved in, and you know someone who's selling drugs, please call us. And you know, we can be anonymous. All we need is a tag number, a phone number, a name, a street, an address, anything. We will take what we can get. We don't need your name. You can text it to us. We have text-a-tip, as well as we have the Crime Solvers. You can call it in and give it to us that way. You can remain anonymous, and we can do the police work from there. But the more information that we get, we've made a lot of good cases off Crime Solvers tips from people in the community, and the more we get, the better chance we have.
I just want to, again, thank everyone for coming and just echo what was kind of already said here, that the only way I think this problem is going to be solved is if people like you here in the community, go home and learn, spread what you learned here tonight, be ambassadors for what you learned here tonight, talk to your kids, talk to your coworkers, talk to your parishioners, your faith-based practitioners, and really, you have a panel full of people up here who have kind of dedicated their lives to working on these issues, and it's just not enough. It's not enough. We need everyone in the community to take some ownership and to really, just like was already said, just get out there and help each other out. And when your kids get a prescription for their wisdom teeth out, stay on top of that. Talk to the doctors, talk to your children, clean out your medicine cabinets. Do these little things, to prevent someone from even getting a chance to start.
All right, thank you. Can we give them a round of applause? So thank you again for coming out tonight, and thank you to all of our panelists, our facility hosts, Spotsylvania County, who helped us, and the church so that we could live stream tonight. for Mr. Ross, who came out and welcomed us, for all of our volunteers, our community collaborative members that are here. It really is a team effort, so thank you very much. And again, please, as Gail mentioned, don't let this be the end of the conversation. There were a lot of questions that we may have not gotten to. We're going to post the answers to those questions on the Community Collaborative Facebook page. If you have additional questions that you would like answered, you can turn them in and we'll make sure that we include those. There are resources when you leave of some things going on in the community regarding the Revive training. I will mention this was handed to me during the presentation, Crossroads Transition Home. I will put this on the back table. Whoever handed this out, I'm sure, is probably here and can answer some questions. But there are resources, and we want you all to have those. And you had your hands. Okay, yes. And then again, my name is Donna Kraus. If you're interested in becoming a part of any of the work groups or the community collaborative, please come talk to me. I'll make sure that I link you up with the right folks to do that. And once again, thank you for being here. Oh, Gail has one more thing.
Just to make a plug, we do start foster parent training soon, and so there are materials out on the table. If this sparked an interest and maybe you'd like to explore that potential, we'd love to talk to you about that. And that message goes out to anyone who's hearing us tonight. We would love to welcome you to our larger family of foster families to help with this.
All right. Thank you. Have a good night.